basically going through the numbers. I think there'll be slides about new infections, hospitalisations and deaths from COVID. And I think that there will be a big emphasis, as there has been all this week, on the booster programme. Now, currently at the moment, we have about 43% of the population who've got their booster. It's somewhere around 89% who have had one jab, somewhere around 81.5% who have had two jabs. You heard Sajid Javid, the health secretary there, saying that actually people were turning up for the first time for some of their first jabs, as well as lots of people coming for their boosters this week. Boris Johnson has talked about a national effort in order to raise the number of people with boosters. But I suppose at the bottom line, Sarah Jane, is that we're in a bit of an odd situation because yesterday Boris Johnson pushed through Parliament in the face of quite a lot of opposition from his own side what I think by any measure you had to call some pretty mild restrictions. Yes, there were COVID passports, which mean that you have to show that you're double jabbed or have a lateral flow test that's negative if you want to go to certain massive outdoor venues and indoor settings. And yes, it does mean a bit more compulsory face mask wearing, and there is the working from home guidance. But they are essentially relatively low-level measures, yet the language that government scientists are using is much, much more alarmist. Let me just read you what Dr. Jenny Harries, head of the UK Health Security Agency, said today. She said that the Omicron coronavirus variant is probably the most significant threat that we've had since the start of the pandemic. So in the last 2 years that we've been enduring this health emergency, there you have one of the government's most senior scientific and health figures saying that this is probably the most significant threat that we've had. Now, that is sounding the alarm in the clearest possible way. Yet, the government response is only been relatively muted, relatively moderate. Yes, working from home, which can make something of a difference, but that's guidance. No sign of lockdowns, no restrictions on people meeting indoors or outdoors, an attempt to stave that off. And the controversial measures that were pushed through the House of Commons yesterday in the face of lots of Tory opposition, with the help of Labour votes, frankly, relatively mild, relatively moderate. And that's because essentially we are waiting for the Omicron wave to hit us. Boris Johnson has described it as a tidal wave. Chris Whitty, speaking to the cabinet yesterday, was clear that it's coming. And yet we are, at the moment, doing comparatively little compared to some other countries in order to try and stem the flow. Now, there are more boosters in place in the United Kingdom. More people have been boosted. But countries like Ireland, France and Germany have started to shut down bits of the economy, things like nightclubs. And other large settings, but the United Kingdom hasn't, and particularly England hasn't begun to go down that path really at all. So the question is, will Boris Johnson have to do that in the coming days? Today, it seems as if Boris Johnson isn't going to do that. He's instead going to emphasise the success of the booster programme and also emphasise the potential threat. But you heard Sajid Javid in that interview that came in barely 15 minutes ago. A bit odd to have the Health Secretary talking just before the Prime Minister, but that's how they do their communications these days is a mysterious thing. But you heard him not ruling out further restrictions. When pressed by the reporter, are there going to be further changes, either in guidance or in law, to how people have to conduct themselves over the next couple of weeks in the run-up to Christmas, Sajid Javid simply said, we keep these things under constant review. And it's going to be interesting listening to the warnings, because if you look across quite a lot of the other newspaper front pages from around the world, you look at the Wall Street Journal, you look at some of the German media, you look at some of the French media, the subject of Omicron isn't dominating in the way that it is in the United Kingdom. Now, this is a point that's being picked up by lots of Tory MPs who are considering, if at some point in the coming days they're asked to back even further restrictions, whether or not they'd go for it. There is a singular focus on this and a ramping up of the rhetoric about this in the United Kingdom that a glance at the media elsewhere in the world doesn't suggest it's being echoed elsewhere. So there are questions from politicians about quite why we're having this quite alarmist talk, but very many sober and serious figures in government are saying that we are approaching a very big problem and that action needs to be taken. There are some suggestions, quite frankly, that there could be further restrictions. Maybe they'll be introduced next week. But the government at the moment is sticking to its guns, saying that the current package is balanced and proportionate. That's the phrase that Boris Johnson likes to use. He is personally not a fan of restrictions. We know that. He's on the more libertarian side of the Conservative Party. But he, when pressed by scientists, has often in the past found it hard to resist some of the things that they have asked that they do. Boris Johnson at the moment really stuck between some in his own party who resist further restrictions, further harm both to the economy and to people's mental health by forcing them to stay at home. That's their objection to it at a time where we don't know whether or not the Omicron variant is mild or serious, or the true medium-term effects of it and the effects on and whether or not the booster programme and the jab programme properly provide a wall of protection against death and serious illness and admission into intensive care. And on the other side, you've got these dramatic warnings from people like Dr. Jenny Harries, calling it, as I was saying earlier, probably the most significant threat that we've had since the start of the pandemic. So I would expect these scientists in this briefing to take us through the latest data. Of course, today we have had 28,610 positive cases. Now, that's quite a high number, and that's the kind of reason that we are getting these warnings from senior scientific figures.
OK, Sam, I just want to bring viewers up to date. We're waiting for a news conference at Downing Street. The Prime Minister will lead that news conference with England's Chief Medical Officer, Chris Whitty, and NHS England's Dr. Nikki Kanani. And they've got clearly some interesting data to show the country. And Sam Coates is with me here. And Sam, I mean, are we expecting to see the data that Chris Whitty presented to the Cabinet yesterday?
I'm sure we'll get many of the same arguments that he made to the Cabinet yesterday. And to be honest, Mark, a lot of the data is publicly available, and I was looking at it just before we went on air just now. And what that data shows is that in the last week or so, we've had a 10% increase in hospitalisations. The figure for new infections today is sharply higher than it was yesterday. That's at 78,610 positive cases. At the same time, they're saying, well, of course, testing positive is a different, lower figure than the number of people who are being infected today, because not everybody is being tested, not everybody who is tested is being sequenced. They think that we are looking at somewhere between 200,000 people or potentially more people actually being infected, with just a much smaller number caught by the testing system. We are on a trajectory, the scientists say, to a situation where you could get, without intervention, 1 million people every couple of days, maybe even every day, getting the Omicron variant. And then we wait to see what happens with a proportion of those ending up in hospital, a proportion of those ending up in intensive care, and a proportion of those sadly dying. Just at the moment, the figures suggest that there are 896 people in intensive care. So we've got quite a lot fewer there in intensive care than there have been at various peaks in the pandemic. But the data at the moment is early because, I mean, we know that we've only really been facing the Omicron variant as a national challenge for the last, 2.5 weeks? It was 2.5 weeks on that Saturday night that Boris Johnson popped up with Chris Whitty and Patrick Vallance just to announce the first changes to the rules, the first reimposition of face masks in certain settings like public transport. And we also know that it takes a period of time for people to get infected, a period of time before symptoms kick in, a period of time before people end up in hospital. And you've got this sort of lag on the data. And that's why Tory Tory MPs are going, look, there isn't a great increase in the number of hospitalisations. There isn't any increase at all. There's a drop in the number of deaths at the moment on the one side. And on the other side, you've got the scientists going, yes, but because there is this 2, 3, 4 week lag in the impact of coronavirus infections, in the impact particularly of Omicron, which is such an unknown because it's such a new thing, you can't be complacent and just point to today's numbers and know that we aren't going to get a big problem throughout Christmas. So those are the issues, and people are poring over the data from South Africa trying to delay. And here we go with the Prime Minister.
Sam, we're going to interrupt you. Yeah, the Prime Minister's about to speak.
Every eligible adult in England can use the National Booking Service to get boosted now. If you're over 18 and had your second jab at least 3 months ago, then you can get jabbed right now. And it's absolutely vital that you do, because the wave of Omicron continues to roll in across the whole of our United Kingdom, with over 780,000 COVID cases today, the highest ever daily number reported. And the doubling rate of Omicron in some regions is now down to less than 2 days. And I'm afraid we're also seeing the inevitable increase in hospitalizations, up by 10% nationally week on week, and up by almost a third in London. But we are also seeing signs of hope, because since we launched our emergency Omicron appeal on Sunday night, a great national fight back has begun. And people have responded with an amazing spirit of duty and obligation to others. And I want to say that each and every one of you who rolls up your sleeve to get jabbed is helping this national effort. And I want to thank everyone who has come forwards, whether you've had to queue around the block at a walk-in centre or whether you've booked online. And of course, on behalf of the whole country, I want to thank our NHS, our GPs, our pharmacists, who with barely a day's notice, 48 hours notice, have so accelerated the programme that we began this week with the biggest vaccination Monday ever in England, and yesterday, the biggest booster day yet, with more than 650,000 boosters delivered across the whole UK. And across the country, after all they've been through, those teams are going to keep going through Christmas and beyond. Jab heroes like Kim Kirk, leading the King's Mill Hospital vaccination hub in Mansfield, who was asked a year ago to do it for 4 weeks and has been doing it ever since, with 180,000 jabs and counting. Dr. Laura Mount and the team at Central and West Warrington Primary Care Network, who've been organising pop-up vaccination clinics for the homeless. Or the team at Home Park in Plymouth, who have been regularly jabbing until 2 a.m. because they just carry on for as long as there are people there wanting a booster. And I want to thank those from every walk of life who are stepping forward to support them. The military personnel deployed across every region of the country, including an additional 100 in Scotland from yesterday, as well as 2,500 firefighters. And since Sunday night, we've seen more than 20,000 new volunteers signing up to help with the booster effort as stewards, taking the total number to almost 33,000. With every day, we're expanding the ranks of these healthcare auxiliaries, an emerging territorial army of the NHS in a race against time to get those jabs in arms and save lives. And if you're watching this and you want to get involved, just visit the website nhsvolunteerresponders.org.uk and do something this Christmas that you can tell your grandchildren about many Christmases from now. In total, we've boosted more than 45% of all adults in England, including more than 88% of those aged 70 or over. And while hospital admissions are going up nationwide, we're starting to see admissions coming down among some of the more vulnerable older age groups where we've already got those boosters in arms. From tomorrow, we're speeding things up even further by removing the 15-minute post-vaccination waiting time. And while we're at it, from Monday, 12 to 15-year-olds can book in for a second jab. And We know how crucial it is to keep children in school, so let's all make sure our children and young people are vaccinated before they go back next term. As we take forward our national mission, we're of course supporting similar efforts by the devolved administrations, which are also rapidly increasing vaccination rates across Scotland, Wales and Northern Ireland. A COBRA meeting with Edinburgh, Cardiff and Belfast is taking place this evening. But already, the pace of rollout across the 4 nations is such that the UK as a whole now has twice as many boosters per head as the EU and more than twice as many as the United States. So let's keep going, let's keep giving Omicron both barrels, and let's slow its spread and give the vaccines more time. Wear face masks indoors, use ventilation, get tested if you're going to an event where you're likely to meet lots of people, and get tested if you're going to meet elderly or vulnerable relatives. And we're helping you to get the tests that you need. I want to thank the Royal Mail, who are doubling home deliveries of testing kits to 900,000 a day from Saturday. So let's slow down Omicron's spread, and at the same time, let's reduce the harm Omicron can do to us by building up our vaccine defences. We're jabbing in hospitals, we're jabbing in surgeries, we're jabbing in pharmacies and in pop-up centres, we're jabbing in shopping centres and on high streets, in football stadiums, with mass events planned at Stamford Bridge and Wembley this weekend, and daily jabathons at Elland Road in Leeds. We are throwing everything at it, and wherever you are, we'll be there with a jab for you. So please, get boosted now. Thank you very much. I'm going to ask Chris to do the slides.
Thank you, Prime Minister. First slide, please. I'll start off with slides that people have seen before, the updates, but I think there is an important thing to point out on this slide, which is the very high spike on the very far right of this slide. And as the Prime Minister said, this is a record number of cases. I'm afraid we have to be realistic that records will be broken a lot over the next few weeks as the rates continue to go up. If we look at the overall rates, it looks as if Delta, which we've had with us for a while, is still flat, and the growth is Omicron. So what we've got is 2 epidemics on top of one another, an existing Delta epidemic, roughly flat, and a growing Omicron, very rapidly growing Omicron epidemic on top of it. Next slide, please. When it comes to hospitalisations, this really always, of course, reflects where we were two or more weeks ago, and therefore the rates have remained reasonably flat over quite a while, reflecting where we've been with Delta over the last several weeks. So rates are currently flat, but they are beginning to increase in some places, particularly in London. Next slide, please. And deaths, of course, reflect what happened even earlier in time. And those are still, if anything, going down very slightly. But this, of course, doesn't reflect anything in terms of Omicron because the emergence of Omicron and its spread is far too recent. Next slide, please. Dr. Kanani is going to talk more about the vaccination in a minute, but I just wanted to give a visual picture of the speed at which the initial rollout, that's in blue, the second dose, which is in orange, and now the booster rollout is occurring in red. And as you can see, it's going up very rapidly and accelerating, and that will continue to happen over the next period of time. Next slide, please. When I showed this slide at the last session, people said they wanted a bit more time on it, and I want to make 2 points on it. What this shows is what the hospitalisation rates and different age groups, where in the dark bars are people who are not vaccinated, and the orange bars are the people who are vaccinated with 2 doses. First point, this provides massive amounts of protection against hospitalisation against Delta. This is what we're showing. But what we're expecting to happen with Omicron is that some of that difference is going to be eroded because it is the vaccines are less well matched to the Omicron variant. This is what the laboratory data are implying. We don't have clear clinical data yet. And therefore, the point of the booster is to try and get people back to as good a position in terms of replicating this really good protection after they've had their booster dose. It will additionally provide protection against Delta and other variants. So that is really what we're aiming to do. But this is, when people say, do vaccines work? I really do think if people look at these data, they cannot really argue, except that vaccines are remarkable at working. But people do still go into hospital even when they're double vaccinated, and they will still go into hospital even after boosters. But their risks are much reduced. Next slide, please. Now moving on to Omicron. And what I'm showing here is a screening test for Omicron. These aren't genotype things. This is what's called S-gene target failure, but now any S-gene target failure pretty well represents an Omicron case. And the reason we're showing this is you get these data earlier than you get the data from the full genotyping. So it's more up to date. Now, I'd like to point out two things with this. The first of which is the count of numbers is now going up very fast. I'd like to point out also that the greyed out bars, those data are incomplete and will increase. Again, I saw some commentary that said, that shows it's going away next time. The last bits of data, and the same is true in the UK, it's also true incidentally in South Africa, the last bits of data will always increase as new data comes in. But both the numbers, but also the percentage of cases is steadily rising. So an increasing percentage of all of our cases is now Omicron. But that's not because Delta's going away, it's because Omicron's being built on top of that. Next slide, please. The final slide I wanted to show is really just to show that this is happening across the whole of England. It's also happening very clearly in Scotland and beginning to happen in Wales and Northern Ireland. But these are data from England. In London, now the majority of cases in London are going to be Omicron. And therefore, that is going to be where we will be from the time we get to probably Christmas onwards. I would expect most cases going to hospital to start to be Omicron cases. I would like to make one final point before I hand on over to Dr. Kanani, which is I think that there has been a certain amount of commentary about the fact that doctors and scientists from South Africa, and I really want to pay huge tribute to South African science and medicine, what they've done so quickly has been remarkable, have indicated that there may be some reduction in the hospitalisation rates they're seeing with Omicron. And I want to put a really serious caution on this, because I think it has been overinterpreted. The first caution on this is simply a numerical one. If the rate of hospitalisation were to halve, but you're doubling every 2 days, in 2 days you're back to where you were before you actually had the hospitalisation. If the peak of this is twice as great, then halving of the hospitalisation rate, you still end up in the same place. And this peak is going very fast. But the second point I wanted to make, which I'm not sure has fully been absorbed by everybody, is that the amount of immunity in South Africa for this wave, because of a prior Delta wave in vaccination, is far higher than it was for their last wave. And therefore, the fact that there is a lower hospitalisation rate is unsurprising. So if you think about what happened to us in the UK with our alpha wave in January, February this year, the infection hospitalisation rate for people over 65 was around 22% prior to vaccination. Once you have a lot of immunity due to primarily vaccination and then also some natural infection, the infection hospitalisation rate in the same age group has dropped to 6%. That's just because there's more immunity. Well, there is more immunity in South Africa now than there was in their last wave. Therefore, some degree of drop is to be expected. Now, that doesn't mean that there isn't some degree of slightly milder disease. That is possible. But I just think there's a danger people have overinterpreted this to say, this is not a problem, and what are we worrying about? I want to be clear. I'm afraid this is going to be a problem. Exact proportions of it, of course, South African scientists and UK scientists and scientists globally are trying to determine at the moment. I'd like to just pass on for the last slide to Dr. Kanani. Nikki.
Nikki, thank you very much.
Thank you very much. So there is clearly one single challenge that our country faces right now, but we have two asks of you as a member of the public. One is please come forward and get your booster. And if you're unvaccinated, come forward and get your first dose. Or if you're severely immunosuppressed, get your third dose. Your vaccine is there and it's waiting for you. And our second ask is please help your incredible NHS team. Come and work with us as a volunteer or a paid member because we need your help. Since the Prime Minister and our Chief Exec, Amanda Pritchard, set out the call to the nation, the national mission around vaccination, we've seen an incredible response. And it's the sort of response we've seen all through the pandemic and through the first part of the vaccination programme. People have come forward again and again to help us, but to get protected as well. And as I've been around the country visiting vaccination sites, I have seen queues around the block, but people have been incredibly kind and thoughtful and patient, looking after our NHS teams while they wait to get protected. Our NHS teams have done an incredible job. Day on day, we are now seeing record-breaking numbers. Yesterday, we saw an incredible amount of vaccinations delivered by community pharmacy alone, absolutely through the roof, and they're doing a fantastic job. But you need to do your part. From today, you're able to book an appointment online to get your vaccination if you're over the age of 18. You go to the national booking system and you can book a time and date that suits you near to where you live. Or if you're travelling, you could book somewhere near to the work that you have to do if you're an essential worker, because we're making it more convenient than ever to get protected. We've already vaccinated over 20 million people with their booster doses. That's over half of eligible 18 and overs and 3/4 of eligible 50 pluses. That's a huge number. And today, when we open the national booking service to everybody who's eligible over 18, we had over 500,000. So that's over 500,000 bookings by the time I left the office to come over here. So I know that everybody wants to play their part. So thank you for coming forward when you're asked to. Thank you for booking now that you're able to. My thanks, of course, need to go to our NHS and voluntary teams who once again are pulling out all the stops. I know that you're tired. I know that this feels hard, but I also know that you can do it. I've heard from countless people around the country saying, we want to help you, we want to help the programme, we want to respond to the mission, because fighting Omicron is the most important thing that we can do. But I want to reassure you that while our GP teams who have been delivering the lion's share of vaccinations will be vaccinating more again, they will also protect urgent and life-saving care alongside cancer care. So be patient with your NHS and with your general practice teams, because they're trying to do everything to protect you as quickly as possible. As the Prime Minister said, our teams are getting out into the community, just like at the beginning of the programme. We are going door to door to look after the housebound. We are asking the severely immunosuppressed to get protected as quickly as possible with their booster if they've already had their first 3 doses. We're asking teachers to come forward during the school holidays to get protected before school starts again. We have got pop-ups, we've got mobile units. We're working with community and faith leaders to make sure that everybody has the opportunity to get this protection. So please come forward. And as the Prime Minister said, we have lots of opportunities to help. I know of many people, many of my friends who I'm incredibly proud of, who are busy as it is, who are saying, I want to come forward and I want to help at vaccination sites around the country. And any little that you can do will help us to deliver this enormous ask. Our team are working as quickly as possible to get volunteers onto the front line. And I just want to make sure that you know that you can all play your part. Get tested when you're asked to and follow the government guidelines. Make sure that you focus on getting your booster if you haven't already. And if you're able to, come forward and join this fight against Omicron. Because I promise you, if you can come and help us, our NHS will be here for you. Thank you.
Thank you very, very much, Nikki, and thank you for everything that you and your teams are doing. It's absolutely amazing. Can we go now to questions from the public? Teresa from Stourbridge. I'll read Teresa's question out. If initial steps to prevent the spread of Omicron in the community have failed, why is the government rolling back on contact self-isolation for Omicron confirmed cases instead of making self-isolation more widespread for all COVID cases to further slow the spread of all variants? So I think what you're asking there, Teresa, is why are we going for the daily contact testing instead of the self-isolation period of 10 days. That's because we think we can get the same result, and we think we can do that without generating what everybody remembers from earlier on this year, the pingdemic. And the reason why I think that's a good idea, Teresa, is because as we go into this particularly tough time of the year for the NHS and many other organisations, we want to keep supply chains running. We need to keep things moving, and a pingdemic would really make things much more difficult. So we think we can tackle it in that way, and we think that's appropriate. Anything you want to?
Well, the only thing I just wanted to add, Prime Minister, was just to re-emphasise we're talking here about contacts. If people have got COVID, if they've got symptoms, we would want people to self-isolate, because
yes,
those people have a high risk of transmitting, and this is an incredibly transmissible virus.
Correct. Thank you very much, Teresa. Addy from Nottinghamshire. With the spread of Omicron increasing, what is your plan for the clinically vulnerable? Do you plan on putting shielding back in effect? I think I'm going to hand that straight over to you, Chris, and Nikki, if you want to comment.
Thank you, Prime Minister. What we've decided is that at this point, shielding came with some very serious downsides for the people involved in the shielding, including loneliness and mental health issues, practical problems. So it's not an area we want to go down if there's any way of avoiding doing so. But there is a lot of things we need to be doing for the clinically vulnerable, and they include, for people who are immunosuppressed, I think hopefully most people who are in that situation know, that they should get 3 doses of vaccine as their primary course, and then subsequently they should get a booster on top of that. So they should have 4 doses in comparison to the rest of the population having 3. And there will also, for example, be things we'll be wanting to look at in terms of antiviral drugs and how we best can use them in this group of people who are particularly high risk. I don't know whether, Nikki, you want to add anything to that?
I think that's fine, thank you.
Thanks.
Good, thanks very much. Let's go to Laura Koonsberg, BBC News.
Thank you very much, Prime Minister. As you've said, there have been more cases today than there ever have been. If now isn't the time for extra restrictions, when will be? And to both of the medics, can I ask you really straightforwardly, do you think it would be better if there were now more restrictions immediately, and should the public cut back on their Christmas plans?
Thanks, Laura, and I'll have a go at that first. And let me explain what we're trying to do. I think this is the right approach. It's a double strategy. It's a left and a right for Omicron. We're going with Plan B, as we said we would, in the event of the numbers starting to rise, and in the event of a new variant appearing. And that's the right thing to do. And everybody, you'll have heard me repeat earlier on what we need people to do: to use ventilation, to wear masks inside, continue to wash your hands, exercise caution, to do daily contact testing and so forth. If you come into contact with somebody who has Omicron, to isolate certainly if you have Omicron. And to get tested when you want to go to a nightclub or another venue. All those restrictions are coming in, and that's the right thing to do to slow the spread of the disease. But what we're also doing is using a tool that we didn't have, Laura, if you think about it, a year ago, when we were also facing a spike, and that is the huge advantage, not just of testing, but also of vaccination and the booster. The booster does provide, all the evidence seems to be, the booster does provide an excellent level of protection. And we think that given the balance of risks and the balance of continuing uncertainties about Omicron, this is the right approach to take, the right mixture of approaches to do these two things at once. And the progress that we're making with the booster is absolutely vital. These numbers are extraordinary for the British population. I mean, we really are boosting huge numbers of people now. We've got a much higher proportion of our population boosted, as I said at the outset, either than the United States or than the rest of Europe. I think over 90% of the 75 to 79-year-olds have been boosted now, and that's terrific because it's those groups, don't forget, that sadly provide the bulk of those who are likely to die from COVID. So by getting boosted now, we can really build up our wall of protection whilst we slow down the spread of the disease with Plan B. So it's a two-pronged effort.
My answer would be that ministers clearly have to choose between really unpalatable options, but what we do not have at the moment is clear data on some of the really key questions, and the two that I think are the most important are what is the hospitalisation of severe disease and in due course mortality rate with 2 doses, which we got right the way through the population of existing vaccines, and what are we looking at with a booster on top. Remembering we've now got the great majority of people over 65 boosted, and that rate is going up. Those data will come in. There's some very early indications from lab studies, but they're not really strong enough to be able to make strong clinical recommendations. And obviously, ministers will take a lot of account of new information as it comes in. In terms of your second bit of your question, I think that what most people are doing is, and I would think this seems very sensible, is prioritising the social interactions that really matter to them, and to protect those ones, deprioritising ones that matter much less to them. And I think that's going to become increasingly important as we, for example, go into the Christmas period. And people are also taking a lot of precautions, and I think this is exactly right, so that, for example, if they're going to visit a group of people, or if they're visiting vulnerable people, they're taking tests beforehand. I would strongly encourage that, and strongly encourage sensible things like really good ventilation, meeting outdoors if that's appropriate and easy, and all the things we know that we've done systematically through this. So I just think a lot of this is people following sensible rules, but prioritising the things that really matter to them and deprioritising the others.
Nikki.
Thank you. I mean, all I would add is that my patients have had very mixed experiences through previous lockdowns, and some have been incredibly isolated and their mental health has really deteriorated. So everything that we can do as a public, as individuals, to reduce the burden of the disease, to get our boosters and to make those choices that Chris describes is right. I mean, I want to see my immediate family on Christmas Day, so I'm going to be really, really careful until I get to that moment. And not just testing, but watching what I do and prioritising, working on the vaccine programme, working in general practice, so that I can get those special moments with my family. And I know that that's what everyone will choose to do if they can, because that's our best way through, along with getting booked for their booster.
Thanks very much. Robert Peston, ITV.
With the best will in the world, the surge in boosting is not going to kick in for 3 or 4 weeks, but now is the moment when people are going to parties, they're going to the pub. Why aren't you more explicitly discouraging them from doing that? Dr. Canini, you said that your colleagues are working incredibly hard. They're exhausted. For 18 months, they've been putting their lives at risk. If I could ask you and Professor Whitty, how did you and they feel when you saw those photos of officials in Downing Street and Conservative Central Office having parties when they were risking their lives and the rest of us were in lockdown? And finally, Prime Minister, would you welcome a police investigation of the parties that took place here?
So I'm going to ask Chris, you want to go first?
I mean, I don't have a huge amount to add to what I said previously, which is I do think people should prioritise what matters, and that by definition means deprioritise other things. And I think people are doing that, and I think I would recommend that, and I think most people would recommend that. I don't think you need a medical degree to realise that is a sensible thing to do with an incredibly infectious virus, about which there are quite a lot of key things we don't know. And then in terms of other areas, I mean, yes, I mean, I think it's a statement of fact that when people think there's unfairness, and particularly if they think there's unfairness in high places, of course people get angry. I'm not commenting on individual cases or commenting on the rights or wrongs of anything, to be honest. I never have throughout this, and I don't intend to start now. But what I do think is most people actually separate that out from their absolute need to think seriously about what's good for them, their communities, their families, their workplaces, and the wider country. And people, I think, really are taking that very seriously, and I don't think those two are in conflict. I think people basically can do both simultaneously.
I think what I would add is that our staff, as I said, have been working for a really long time, both through the pandemic and to deliver this incredible vaccination programme. And I think they'll keep going. You know, whatever else happens nationally in other places, we're here to look after our patients and our public. And that's what drives me every day, you know, no matter what else is going on. And that's what my teams and my colleagues will continue to focus on.
And I just say to you, Robert, that I think you completely mischaracterised the events in this place where people, to the best of my knowledge, have worked blindingly hard for a very long time in cooperation with people around government and across the whole of the public services to do our very best to keep people safe. But we'll, of course, hear from the Cabinet Secretary about what he believes has happened. And indeed, you know, if the police think there's anything to follow up, I'm sure that they will. But I think that, if I may say so, I think that the public can readily, as I think colleagues have said, the public can readily distinguish between these types of reports and these types of accounts and the overwhelming imperative that we have now together to tackle this disease in the two-pronged way that we are. And I think those are the messages that I'm seeing the public understand very, very loud and clear, and really responding magnificently with the way people are. You said it, you know, it'll take 2 or 3 weeks for the vaccine rollout to get going. That's not my impression. It's
the immunity to build up.
Well, I think actually I think that is a moot point, because I think that I'd like to hear from Nikki and Chris on that. I believe that with the booster, you start to get at least some immunity, perhaps a bit quicker than you've suggested, but perhaps that would be...
Well, I think the general point is a very reasonable one. Actually, the timing, yes, I would expect some protection, probably even beginning within a week, and quite a bit within 2. So it's a bit quicker, but your general point, which is, of course, there's going to be a delay, is a fair one. It's just probably slightly less than you're implying. Nikki?
Yep, I mean, all we can do is move as fast as we can so we can get people protected, and that's why the other points that Chris and PM have already made are right. You know, we follow the guidance that's there. Work from home if you can. We need those trains as empty as possible so essential workers can go in safely. Wear your mask as much as you can, and look after each other. That's what we're here to do.
Thanks. Tom Newton-Dunn, The Times.
Professor Whitty, question for you. Jenny Harries today said the Omicron variant was the most significant threat to public health we've seen during the pandemic. Graham Medley, as you know, chairs SPIAM, has called it a very real possibility of the NHS being overwhelmed. Do you agree with those two statements? And may I also ask you just to give us a little bit more detail on what you said were studies on severity and mortality? You said they weren't complete yet, but can you share with us what you know so far on that? Prime Minister, a question for you. I want to bring up the vote last night. Sorry about that, but it is relevant to this whole discussion. Now, a lot of your MPs say it wasn't just about COVID passes, it was about you. It was about your leadership, and they want you to change. They want you to run a better operation, a better number 10, and stop putting the car into the ditch, to use your words. Will you change, and if so, how?
So on the first one, and echoing a point that Nikki made, this is a really serious threat at the moment. How big a threat, there are several things we don't know, but all the things that we do know are bad. And the principal one being the speed at which this is moving. It is moving at an absolutely phenomenal pace, and therefore between the time that it first starts to really take off in a way people will be able to see, and the point when we get to very, very, very large numbers will be quite a short one. And that, I think, is part of the issue in trying to deal with this. So I certainly echo the fact that this is a very serious threat. I think to compare it to each of the very major threats we've faced, I think it's quite difficult because, as the Prime Minister said, we do have some things going for us this time, of which the most important is the existence of effective vaccines and the ability to boost at speed at this stage. So I think I do not wish to underestimate this. And for my NHS colleagues in primary and secondary care, I am afraid there will be an increasing number of Omicron patients going into the NHS, going into hospital, going into intensive cares, and the exact ratios we don't yet know, but that there will be substantial numbers, and that will begin to become apparent, in my view, fairly soon after Christmas. It'll start before then, but in terms of the big numbers, I think that's a reasonably, I'm afraid, a reasonably nailed-on prospect. In terms of what I was trying to explain on the severity, and it is a relatively subtle point, but I wanted to make it because I think it's been misunderstood. There are broadly two ways that a virus like this could be less severe if someone's caught it. One of which is it's intrinsically less severe, it's just as a milder virus, and there are milder and more severe viruses ranging from ones with 100% mortality, rabies, for example, all the way down to ones with essentially 0% mortality. So you could have a move on that. But the other way, which is much more common actually, where something becomes more severe, is because we have more immunity. And the point I was making is South Africa, between the last wave and this wave, their degree of immunity has substantially increased. And therefore, there is much greater South African immunity to COVID in general, not specific to Omicron, than there was in the last wave. So some decrease in severity you would expect because of some protection from increasing immunity. In contrast, for our Delta wave, we already had incredibly good immunity due to the amazing job the NHS has done in double vaccinating everybody. So we don't have that additional thing on top. So it may be that some of, possibly even all of, any decreased severity from South Africa is just explained by immunity, and if that's the case, that's not something you would necessarily replicate here. The second thing is from South African data, incidentally, of course, is that their age groups are very different. There are a number of other very major factors, HIV, a whole bunch of other things. So reading across data, I think, needs to be done with very strong care. On mortality, so we do have hospitalisation data from South Africa. The rates in hospitalisations in South Africa are now going up relatively fast. On mortality, we do not yet have data, and that's because this is so recent. And of course, as everybody knows, there's a lag to getting infections, a lag to getting symptoms, a lag to getting to hospital, and then a lag to a minority of people dying. And that time frame has not happened. So we don't yet have data on mortality. And obviously, as soon as we do, we will share it with the public.
Yeah, and Tom, just on your point about Parliament, look, I do understand the people's feelings of principle about what they see as infringements on liberty, and we've been trying throughout this pandemic to keep our lives as open and as free as possible, and that's the aim of what we're doing. Indeed, the aim of Plan B Plus, the Get Boosted Now campaign, is to ensure that our next year is as free and as open as possible, and we protect our society and our economy in every way that we can. I have to say, I don't think that the measures that we're proposing or that Parliament's enacted for nightclubs and some other settings like football matches in any way amount to a vaccine passport, because after all you've got to do, you've just got to get a lateral flow test, or if you have proof of vaccination, then you can get in. It's entirely optional. So I don't follow that line of argument. But I just want to say I'm grateful that Parliament voted it through. Large majority of Conservative votes went to get this done, and it will help us to keep the country on track. I think if we can do these two things at once, implement Plan B in the way that we're describing, plus get everybody boosted at record speed in the way that we are, we'll be able to move forward and keep on the path that we have begun to travel. Now that is made possible because of the incredible efforts of the NHS and the British public, and those are the people I really want to thank. I realise I said you were from the Times. In fact, you're from Times Radio now, Tom.
Was about will you change? It wasn't about the vote last night. They want you to change.
I'm certainly not going to change. Thank you very much, Tom. I'm certainly not going to change the policies that have led to the fastest vaccine rollout in Europe, the fastest booster campaign in Europe now, and delivered 500,000 more people in jobs now than there were before the pandemic began. And those are the things which I would respectfully suggest that the public are also keen to focus on. Steve Swinford of the Times.
Professor Whitty, in Scotland, Nicola Sturgeon is advising people to limit household mixing over Christmas. Is that something that you think families should be thinking about as we approach Christmas, to limit the number of other households that they interact with over the Christmas period in their own homes. And Prime Minister, the last time that you held a press conference, you were saying that people should go ahead as normal with Christmas parties. Now, we've just heard Professor Whitty say we should be deprioritising less important social events. So do you think that people should still be going ahead with Christmas parties, or is it time to cancel Christmas parties? And furthermore, about New Year, what are you thinking about New Year? Should people be planning big social events at New Year, or should they be limiting those now?
Chris.
I mean, I'm probably going to start record on this. I really think people should be prioritising those things and only those things that really matter to them, because otherwise the risk of someone getting infected at something that doesn't really matter to them and then not being able to do the things that do matter to them obviously goes up. I don't think you need to be a doctor to think that. I think that's what most people are very sensibly calculating, and that seems to me a sensible approach, personally.
Yeah.
The whole point about the point I'm making is don't mix with people you don't have to for either work or for the sort of family things that really matter to you, would be my general advice to people in this kind of situation. But people have to make their own choices.
Yeah, thanks, Steve. I agree totally with Chris about the response that we're already seeing from everybody, our general instinct to be more cautious. But I said many times that I thought that this Christmas will be considerably better than last Christmas, and I stick to that. We're not cancelling events, we're not closing hospitality, we're not cancelling people's parties or their ability to mix. What we are saying is, think carefully before you go. What kind of an event is it? Are you likely to meet people who are vulnerable? Are you going to meet loads of people you haven't met before? And get a test. And I think that is very, very good at make sure that there's ventilation, wear a mask on transport, and get a test before you go. So we're in a different environment thanks to the boosters from where we were last year. But we've got to be cautious and think about it whilst we wait for the benefits of the boosters really to kick in. Thank you. Mesa Hall, The Express.
Thank you, Prime Minister. If I could ask the medical experts, I mean, it's becoming clear that we're going to need to keep having boosters to keep topping up our protection against coronavirus. I mean, what's your best guess for how often we're going to need to do it? Is it going to be every 6 months, every 3 months? And is there a case for a permanent national vaccine service to deliver boosters? And Prime Minister, if I could just pick you up on the, you talked about keeping supply chains moving earlier. Obviously, there's going to be a lot of work absence as people become infected and have to take time off work. Are you concerned at all that emergency services, essential industries may come under pressure, and what steps are you doing to cope with that?
Thanks.
Shall I take the first bit?
Chris, then Nikki, and then I'll do supply chains.
I think it's not yet clear how often we will need to do boosters. Essentially, there are two separate reasons to need to do a booster. The first one is that the immunity was good, is still good, but is waning. So that's a matter of topping it up from time to time. And then the second one is, as we got with Omicron, something comes in field left that actually the vaccines work less effectively against, and you need to do something to actually top it up, to actually get on back to where you were before the new variant came in. Now, on the first of those, we don't yet know how long the immunity will take to wane. In general, I think most people who look at this would say that after a booster, the waning may be a bit slower than it was after the second vaccine, but we don't know that. And so we need to see those data and make decisions on that. And of course, immunity is quite complicated. It's made of several different elements. It's not just antibodies, it's a variety of other ones. But of course, whenever we do get a new variant, for the moment, we have to ask the question, does this need a new vaccine, as is being asked at the moment? Now, in the long run, my expectation is, and when the long run doesn't mean many years, but maybe not this year, in the long run, we would expect that we'll get what's called polyvalent vaccines, where you have multiple different forms of the virus in the same vaccine. And the reason that's important is it makes it a lot harder for the virus to evolve around that. At the moment, we've simply got a single thing based on the original strain. Once we've got those, I think new variants that can do as much change as Omicron will probably become rarer. Still may happen from time to time. But we do now have technologies that mean we can move them very quickly. That's a long answer, but I think it's something which a lot of people ask, so I thought it was probably worth laying that out. Dr. Kanani may want to comment on the second bit.
Yes, thank you. Thank you. I mean, it's something that we are obviously thinking about. How do we get the right vaccine infrastructure? Prior to the pandemic, which feels so long ago, we did have a vaccine infrastructure. It was our general practice and community pharmacy teams that would vaccinate children. It was our school teams that go in and vaccinate in schools, and obviously our annual flu vaccination. So we're used to having to do things annually and cyclically, but we are definitely in a different position now, and we can't keep using sort of big venues every time. So we are putting that infrastructure in place. We are asking, obviously, as you've seen, our community pharmacy colleagues to step up, but we're also seeing that other venues are offering their services, not just now, but into the longer term as well. So as we learn what we need to do to respond to this variant, we'll build the infrastructure in the background so that once we know the sort of pattern that we're going to have to respond to, we'll have that infrastructure in place.
And Mesa, to your point about supply chains, we're going to throw everything at it to try to sort it out. Actually, some of the issues that we saw earlier in the autumn have started to get better, like the HGV driver shortage. But we are going to make sure that we do everything we can. We're recruiting huge numbers of people, for instance, for the NHS, trying to help the care sector, so vital that we get the staff there. Daily contact testing rather than self-isolation, I think will help. I'm not going to pretend this is going to be necessarily as smooth as everybody would want, but we've got to get through it and repeat the key message. The best thing everybody can do is get boosted now. Get the booster fast as you can, and the higher our wall of protection. Andy Woodcock, Independent.
If I could ask the medical experts, you've suggested that people will be prioritising family get-togethers on Christmas Day itself this year. I think a lot of people out there will be thinking that situation, you have multiple generations coming together from multiple households in close quarters, quite possibly very little ventilation, particularly if it's a cold day. I think people will want reassurance. Is it really advisable for that sort of event to go ahead? And could I ask all three of you, are you planning to, what are your plans for Christmas Day itself, and are those being scaled back? And to the Prime Minister, since the reports of various parties at Downing Street, or alleged parties at Downing Street, there have been polls suggesting a fairly sharp fall in public trust in politicians generally, and in yourself personally. Keir Starmer today said that you didn't have the trust and authority to lead the country through this crisis. I was wondering, while the questions about alleged rule breaking are still unresolved at Downing Street, that is, are you still confident that you are the right person to be giving instructions and guidance to other people in a way that will maximise public compliance?
Thank you. Chris and Nikki on Christmas.
I didn't say what people would be doing. Some people will prioritise Christmas Day and some people will prioritise other things. All I was saying was people should prioritise what matters to them, and usually that is family, that different people from different traditions will take different approaches. In terms of, but Christmas is clearly the majority at this time of year. In terms of realistically, I think there's a high chance that my original Christmas plans with family are going to be interrupted. I hope it's not completely, but we shall see. And I also am very realistic about the fact that in advance of the situation where large numbers of people enter a hospital, very large numbers of people in society, and that includes doctors, nurses and other healthcare workers, are going to get COVID at the same time, because this will be a very sharp peak, and there will be significant problems of people actually providing staff to man and to generally be able to look after any part of the health and social care system. And so people like me should keep some degree of flexibility to actually deal with the fact that actually we may end up with quite substantial gaps in rotas at short notice. And I just think that is, unfortunately, given what and this is back to Nikki's point, given how much difficulty my health and social care colleagues have had over the last 2 years, saying that is pretty depressing, because they have really, really had to stand up and go back again and again. But the reality is the speed of an onset is going to lead to lots of people getting ill simultaneously, and we have to be realistic about that.
Thank you. Andy, this is our chance to make choices for each other and for our NHS. So my advice would be, if you're going to go to a stadium at the weekend, make it one where you can get your vaccine or help out to give a vaccine, rather than going to watch a match. And to that point, if you're a role model in society, please get your vaccine, because actually it's dependent on all of us to show the way right now and to make decisions that help to protect society. As for my Christmas plans, they're already scaling back. There will be far fewer things that I'll do with my children as we run up to Christmas. And if they're listening, sorry, but that is absolutely a fact. But we will enjoy it together, and we'll enjoy it at home, and we will enjoy it safely. And as and when I need to work over the Christmas period, I will be just as my colleagues will be, because that's what we're here to do. So everyone, just book your booster now, because that is our best way to protect our NHS and to protect the people who are giving all of their time and energy to look after our public.
Yeah, Andy, as for my own Christmas plans, I think the way things are looking, I expect a lot of us are going to be working throughout the period. My own plans, as you can imagine, are pretty modest at this stage. But I just, on your point about rules, I think I follow the rules. Everybody across politics should follow the rules. But what I notice actually is that the British public, in response to what we said on Sunday, have really got the point that this wave is coming in, that there are two things that we need to do, that we need to implement Plan B. That's now going ahead, but everybody also needs to be getting vaccinated, getting the booster. And that's I think the numbers are extraordinary. People are queuing round the block across the country, in towns and cities across the UK, and every day we're adding more and more people, more and more volunteers. 33,000 now coming forward, another 20,000 people coming forward to help get jabs in arms. And that message is unquestionably getting through to people. It is a fantastic thing. It's absolutely vital that people hear it loud and clear. So I'm going to repeat it. Get boosted now. Thank you all very much. Thank you.
Well, there we are. That's the Prime Minister confirming, first of all, that there is a new record number of cases in the last 24 hours. Also, a 10% increase in hospitalisations, he said, in the last week. But he said they've boosted more than 45% of all adults in England, more than 650,000 booster jabs given yesterday. But the Chief Medical Officer, Chris Whitty, warned that Omicron was a really serious threat. A number of records will be broken in the coming weeks, he said, because we have two epidemics running at the same time. Hospitalisation rates are beginning to increase, he said, in some places. There is going to be a problem, he said. Substantial numbers will get ill simultaneously. He also said that he urged caution about reports of a drop in hospitalisations in South Africa. And he said vaccines are less well matched to Omicron. And that is why, he said, it is so important for people to get the booster jab. It's just coming up to 6 o'clock. Let's bring in our Deputy Political Editor, Sam Coates. And Sam, I suppose the big question from that is, will the booster campaign be enough, or will other guidance or measures be necessary quite soon? In short, what sort of Christmases, are we going to have?
Well, Mark, Boris Johnson insists that he has the right approach. That was his phrase. But watching that press conference, it was like watching two different events almost. In parallel, you had the much more cautious, much more downbeat interventions from Chris Whitty, the Chief Medical Officer, and Nikki Kanani, the Medical Director of NHS England, and then a slightly more boosterish approach from Boris Johnson. So to take you through the key messages from Chris Whitty, because I think it was Chris Whitty who was the star of today's show, he said, as you mentioned, that we have to be realistic. Records are going to be broken, not records in a good way. These are records in the number of infections, potentially hospitalisations, possibly deaths. We are waiting to find out what the data is on the impact of the booster programme and the jab programme on Omicron. But Chris Whitty currently worrying that records will be broken because you've got these two epidemics. And he was talking there about Delta, which was until a couple of weeks ago the predominant variant in the United Kingdom, and then Omicron, which has rapidly caught up, pushing up those numbers to record numbers of cases today. Chris Whitty also said that there will be big numbers fairly soon going into hospital after Christmas. He said that prediction for him was reasonably nailed on. And then he made a plea not for all of those people looking at social media, seeing just the first signs that Omicron might not be as severe. It is certainly transmissible, more transmissible than any other variant, but it might not result in particularly severe illness if it does take hold. He said there are several things about Omicron we don't know, but the things that we do know are bad. And he issued an enormous, very clear health warning that the data coming out of South Africa suggesting it's mild may not be applicable in the United Kingdom simply because of the different circumstances, the different timings of the different waves and the different types of immunity in that population. He said that the figures from South Africa suggesting that Omicron was milder have been overinterpreted and suggested that the lower hospitalisation rates are a result of the big Delta wave that they had not long ago. And then you've got the question that you touched on, Mark, which is the one of restrictions. Now, you watched Nikki Kanani from NHS England and you watched Chris Whitty trying not to deviate from the government line. But frankly, the message was a bit different to that of Boris Johnson. So Chris Whitty said, please prioritise the social activities that matter to you. Don't mix with people that you don't have to, be they at work or at home. In other words, if you don't much like your colleagues, don't go to that Christmas party, don't go to the social events at home, perhaps with people that you aren't great friends with. In other words, reduce the amount of social contact that you're having. Nikki Kanani talked very personally. She said this Christmas she's going to do less. They're going to see less people. She apologised to her own children for saying that and said, if you're going to go to a stadium, go there to get a vaccine rather than see a match. Now, there are lots of people with tickets to games this weekend. How will they be left feeling after that warning from Nikki Kanani? But in the face of that, Boris Johnson's tone was a bit different. He said, yes, it's right to be cautious, but then he re-emphasised we're not closing hospitality, we're not cancelling parties, we're in a different environment thanks to last year. The guidance remains the same, which is that you can go and do all of these things. Boris Johnson is embracing a world in which individuals act with greater caution, but is also trying to make clear to the public that he's not in the business of cancelling everything. So it's up to you, not up to them, not up to him. Couple of consequences of that. First of all, well, what about hospitality, the hospitality industry up and down the country? The Prime Minister leaning slightly into people being cautious. That's going to be devastating in terms of their bookings over the next weeks and months. No sign particularly of any help from the Treasury to help to assist with that. And secondly, people will be saying, if there aren't restrictions, why can't I go ahead and do this in some cases? Their guidance is somewhat grey area. You're getting different tones from different figures. What is the public to make of that?
OK, Sam, thank you very much indeed. And joining me now is Dr. David Nabarro, Special Envoy on COVID-19 for the World Health Organization and Chair of Global Health at Imperial College London. Thank you, David, for being with us. So I think we start with, well,